Hello. Good morning, everyone. So we are here today. I want to thank everybody for being here today. My name is Pilar Schiavo. I'm Assemblywoman from District 40, representing the North San Fernando Valley, Santa Clarita Valley, and Castaic. It's a great area. Thank you. So I want to thank everyone so much for being here today to call on the federal government to protect Social Security, Medicare, and Medicaid, or what we call Medi-Cal here in California. And we know that if cuts are made to these vital programs that millions of people in our state depend on, that our taxpayers and tax dollars go to pay for, that it will be devastating to communities across California. As a former nurse advocate, as the daughter of a veteran and chair of the Military and Veteran Affairs Committee, I am deeply aware of how much damage these cuts would cause and the deep impacts they would have on our families. You'll hear stories today from speakers who can talk about how it can impact them and how it will impact them, but I want to lift up a couple points. And I want to take a point of personal privilege to my dad, who's a Vietnam veteran, passed away yesterday. And he would want nothing more than for me to be here today to fight for Medicare and Medicaid and Social Security, which he relied on. And so I might get a little emotional today, but we are here to fight in honor of my dad and every other veteran who is going to be hurt by these cuts that are proposed by the federal government, by Congress, and the federal administration. One example is Ridgecrest Regional Hospital, which serves a remote community that is surrounding the Naval Air Weapons Station in China Lake. This is a weapons station that is vital to our national security. And the residents there rely on Ridgecrest Hospital. The people who work at that naval base rely on Ridgecrest Hospital. Their families, they are scientists and engineers who are doing some of the most amazing work on our defense to keep our country safe. And if there is not a hospital in their community to take care of them and their families, they will not be able to work there. This is very much an issue that's critical to national defense and our security. And we know that Ridgecrest must continue, but they heavily rely, a third of their hospital's patients rely on Medi-Cal. And so if Medicaid cuts go through and limit the residents' crucial access to health care, it could compromise their ability to sustain themselves. And the nearest hospital with a trauma center is 2 hours away, would be the backup. So in seconds, when those who need medical care can't drive 2 hours, that's not an option. And these cuts are not an option for our communities. Particularly, eliminating Medi-Cal would disproportionately harm veterans. 1 in 4 veterans experience mental health conditions, and Medi-Cal is often what they rely on when they can't have access to a VA. How dare the federal government even consider these cuts? Cuts to people who have risked their lives for our country and who rely on these to stay alive. My dad fought cancer 3 times because of his exposure to Agent Orange. And the treatment that he received was so harsh that it damaged his heart and his lungs. And so at the end of his life, he was really struggling. And he fortunately had the VA, which also is under attack right now. But he also relied on Medicare. He relied on Medicare for his hearing aids so he could hear us tell him he loved him. And Thank you. And we know that there are many other people telling their loved ones that they love them who rely on Medicare, who rely on Medi-Cal, and who rely on Social Security to put food on the table and stay alive. And so this is why I've introduced Joint Resolution 3, calling on Congress and the federal administration to protect Medicare, Medicaid, and Social Security for our communities, for all of the people here today, for all of the people that we love in our families, for all of the people in our communities who are relying on this for their health care. This is why we're here today, to make sure that we protect that. And to talk more about how veterans are going to be impacted, I want to introduce David West, who is the president of the County Veteran Service Officers here in California, and also works here in Nevada County as a veteran service officer. So, David, if you could come up. Thank you.
Thank you very much, ma'am. Good morning, everyone. My name is David West, and I am president of the California Association of County Veteran Services Officers. I am thankful for the opportunity to address a matter that deeply impacts millions of Californians, particularly our veterans, the proposed $880 billion cuts to Medicaid. Medicaid is a critical support system providing health coverage to millions of people, including veterans who have served this country with honor. For many of our veterans, Medicaid is the lifeline to their health care, especially for those who may not qualify for VA benefits, or for those facing disabilities, mental health challenges, and chronic conditions that require ongoing care. While the Veterans Health Administration provides essential health coverage to many veterans, it's important to recognize that a significant number of younger veterans, especially those under 65, still rely on Medicaid for their health care needs. In fact, approximately 1 in 10 service members are enrolled in Medicaid, and 2 in 5 veterans rely on it exclusively. For them, Medicaid isn't just an option, it's a lifeline. Veterans, especially those in rural and underserved areas, depend on Medicaid to access affordable care. Cutting Medicaid funding would lead to fewer health care providers and longer waiting times for critical treatments, making it harder for veterans to get the care that they need. Imagine a veteran with service-related injury, PTSD, or even just the natural health issues that come with age. These cuts could significantly hinder their ability to access necessary health care and support. On top of that, we cannot forget the role that SNAP plays in supporting our veterans and their families. More than 20,000 military families, 213,000 members of the National Guard and Reserve, and 1.1 million veterans participate in SNAP nationwide. Recent data shows that around 90,000 veterans in California rely on this program. This is especially important when we consider that many veterans face financial challenges as they transition back into civilian life, as SNAP helps them put food on the table and support their families. I need you to think about those transitioning single mothers who are coming in and trying to find workforce. This provides them to allow for their families during their transition. However, if the proposed cuts to these programs go through, the impact will be dire. Without sufficient federal funding, California counties may be forced to backfill these cuts, which could lead to difficult trade-offs. One of the first services at risk could be the support provided by your county veteran services officers, which help veterans navigate the benefits and services available to them. The loss of funding can mean that veterans who rely on these vital services may find themselves without the assistance they need to get and the care and support they deserve. I want you to take a moment and remind you that we all know of veterans who are directly impacted by these programs. Perhaps you heard the story of the local veteran struggling to make ends meet, or a family who relies on Medicaid for medical care. These stories are real, and their challenges are growing as these cuts threaten their ability to access the programs that sustain them. Now, often as a veteran services officer, we hear about veterans that hurt themselves and were homeless and raised that exceed the normal general population. And that much is true. However, 90% of us do well in our post-service life, and it's through access to these programs that allows our veterans to thrive during their transition and later stages of life. Veterans give so much to this country. We cannot allow them to be abandoned in their time of need. We must stand together to oppose these cuts and ensure that our veterans and their families continue to have access to the health care and nutrition they need to thrive. Let's protect Medicaid, protect SNAP, and most importantly, protect those who sacrifice so much for our freedom. Thank you.
Hello there. My name is Henny Kelly, and I'm on the Legislative Committee for the California Alliance for Retired Americans. And when we were looking for somebody to take this resolution and get it passed, we went to my friend right here, because we knew she would do it and get it done. And I want to thank you on behalf of the California Alliance for Retired Americans for doing this. I am a retired American, and this is all about freedom. The freedom to live, the freedom to see your grandchildren grow up, the freedom to get somebody to help you when you need help because you're hurting. That's what it is. There's an old Union song. It's called Freedom. Freedom is a hard-won thing. It's not as easy as the rain in spring. It's not as easy as a bird on the wing. Freedom is a hard-won thing. And you have to work for it, fight for it, day and night for it. And every generation has to win it again. Think about that. Every generation has to win it again. So pass it on to your sisters. Pass it on to your brothers. Freedom is a hard-won thing. And we've got to fight for it. Fight for it day and night for it. And this is what these people are doing out here. And this is why we are fighting for it. And we will be fighting for it forever. All right? So we have some people that are going to tell you about their fight. And the first one is a good friend of mine, Diana Medoshi. Diana Medoshi is part of CARA. She is a wonderful woman, and just like me, she's from a generation that has been telling our children and grandchildren what to do. You tell them.
Henny, that's a tall order, but as long as I got a breath in me, I'm going to stand up for what's right. Good morning. I am Diana Medoshi, a 30-year resident of Placer County, a retired registered nurse, and a recipient of Social Security, Medicare, and Medicaid/Medi-Cal. Today, I am very frightened, as are many seniors and persons on disability who receive Social Security, by the threats from the Trump administration and his henchman, Elon Musk, to defund and dismantle Social Security, Medicare, and Medi-Cal/Medicaid. I've worked since I was 17, paying into the Social Security system as part of my wages, and contributed to an IRA account to help out with my eventual retirement. Some years ago, I became very ill with an autoimmune disease and was unable to work. Treating my illness was expensive, and I ended up having to spend the money from my IRA early. My savings were eradicated by my illness. So all I had left for my retirement was my Social Security benefits. The Social Security safety net, the social safety net of Social Security caught me. It underscores the program's fundamental humanity. Social Security is not a welfare check. I work hard and paid into the system as others have done. Social Security was and remains a life-saving program for myself and millions of seniors. Politicians and Wall Street types have long had designs to privatize Social Security. They have sought ways to undermine the program and cut benefits at every turn. It is harrowing to watch the wealthy and powerful, like Elon Musk, and GOP congressional people propose to dismantle the program. Ever since I've learned about our Social Security information and benefits were at the mercy of Elon Musk and his young computer hackers, I have been gripped with fear. So has lots of seniors. Social Security, I repeat, is my lifeline and the lifeline of many. It is my only income, and if I lose my Social Security, I could become homeless. Protecting Social Security is crucial to me and to millions of seniors and people on disability who paid into and depend on the system. Protecting Social Security is keeping the promise America made to its seniors. Thank you.
And thank you very much. By the way, she's amazing, and she's going to live for another 25 years. All right, we have an assembly member here, Dr. Jasmeet Baines, and she is, well, I'm old, and the glasses don't always work, and we all know that it isn't just a man or a woman anymore, or no, it is only a man or a woman now, but we'll do something about that. Why don't you introduce yourself, and I'll give you a hug first.
You're absolutely right. And for, this launches Women's History Month, and standing before you as a female physician, it wasn't too long ago that women were not even allowed to become physicians. So it is such an honor to be here today. Good morning. Thank you to everyone that is here today. Thank you to my colleague, Assemblymember Schiavo, for being so strong, for showing up today after losing your father. I cannot imagine the strength it takes to be here. Thank you so much. And she's here. Regardless, I talked to her last night and she said, no, I'm going to be there. Said, you should take some time to yourself. But you know what? That's how important this is. This is serious. This is not a laughing matter. I have been working day in, day out, servicing my community as a doctor. I became a doctor to provide health care, to be that public servant. I have been working tirelessly at the front lines of COVID-19, at the front lines of the fires. I was deployed out to the recent LA fires, and I come back and hear that congressional Republicans are voting to cut Medicaid and Medicare? You want to know what adds injury to insult for a physician that has been working nonstop around the clock for her patients? This right here is one of the worst things that you can imagine happening to not just my community. And let me tell you, my community, over half of the people rely on Medicaid. That's more than any other part in the nation. It's one of the highest in the nations. And Republican Congress thinks it's funny? This is not funny. I want one of them to stand next to me when I spend a day in the clinic in my community. I want one of them to stand with me and see the disaster that is going to happen should they pass these Medicaid cuts. I am so proud of everyone that is here today, because when I saw that vote go through, it was a really, really bad day for me as a doctor that only wanted to provide her services as a physician. My community elected me as a doctor to come up here because they wanted their doctor to go and fight for their health care access, and that's what I've been doing. Do not stand there and say that you care about the fentanyl crisis and then cut Medicaid and Medicare behind closed doors. Thank you guys so much for being here. It is an honor as a female physician hitting off Women's History Month, a day that, you know what, not many could have seen for women. So I will continue fighting, and thank you guys for being here, and thank you, Pilar, for being so strong today.
Oh,
Okay, we're going to keep it as a backup.
there are cheat sheets everywhere. I remember I'm going to be 83 in just a few days.
All right.
And I lose paper everywhere. I can barely read, but don't worry about it. We have Rosa Gregorio, a clinic worker and a case manager at Communicare Olay here in Sacramento, who would like to tell you why she's here.
There you go.
And I got the she right.
There you go.
Okay. Oh, I've never been on one of these before. Okay.
Make it comfortable for you.
Thank you.
You got it.
Is that okay?
Can everybody hear me?
Yep.
All right. Hello, everybody. My name is Rosa Gregorio. I've been a case manager at Salud Clinic in West Sacramento for about a year. Our clinic is part of a network of 17 sites across Napa, Solano, and Yolo counties. We serve more than 70,000 Californians. Clinics like mine are what's known as FQHCs, federally qualified health centers. That means we rely on federal funding as much as our patients do. FQHCs like ours provide so many services to our community. People come to us for everything from family care, dental, behavioral health care, to substance use treatment, nutrition, and more. And when I say more, it's much more than that. We are almost like a second family to a lot of people, and we work together as a team. I work with our wonderful providers, our medical assistants. All of us work together to take care of these people. And no 2 days are the same for me. One day I'm helping a patient sort out their insurance details so they can see a specialist. The next day I'm helping someone fill out a housing application. The next day I'm helping someone get a phone. I mean, every single day, a tent, because it's going to rain tomorrow and we need to find a tent so you're not sleeping outside because housing is so hard to obtain anyway. And it's so rewarding when you see how the time you spent with someone made a huge difference in their lives, or even a little difference. It doesn't even need to be a big difference, but you're there for these people. And now they're housed. Now they have access to health care, food, other resources that a lot of people don't think about every day, that a lot of people struggle to have access to. In case you can't tell, I love the work that I do, especially working with the people in our community, the families, and I've always worked for nonprofits, but this is my first time working in healthcare, and I love it because I can see how much it affects people's lives. I am paid pretty much through Medi-Cal, so to be case managed by me, the specification is that they are assigned to Medi-Cal. They are receiving Medi-Cal benefits. So I help people to navigate the system so they can get the resources that they need to survive. So like many of you, when I heard about the cuts that are on the table right now, I was overwhelmed with fear. First and foremost, fear for our patients. We've already had so many conversations. For a lot of these people that don't even have a family, I'm like the person that they come to, right? I'm the person that they come to first when something's scary. So I'm getting these calls from people who are, seniors, veterans, single parents, I mean, you name it, people with varying health conditions, and they're scared. They're scared of losing Medi-Cal, they're scared of losing Medicare, they're scared of losing CalFresh, they're scared of losing their housing. They're scared of losing everything because of what a few people decided for them. And I have to admit, I'm not sure what to tell them. I want to be the person that brings them peace. And usually as a case manager, when they come to me with an issue, I say, okay, this is how we're going to solve it. We're going to do this. Let's plan it out together. But at this point, I don't know what to say sometimes. Losing Medi-Cal funds would be devastating for our whole community. Not only would families and children be more likely to go without the care they need, but if serious health issues arise and they don't have Medi-Cal, they'll probably end up going to ER. And that's part of why my program exists, is to help deter people ending up in the ER. If they're receiving the medical care that they need, then they won't end up necessarily in the ER. It raises healthcare costs for everyone, but it also means a medical emergency that could bankrupt or financially destroy the families we see today. It could impact their housing, access to food, everything. And not only that, just having access to medical care, it keeps them from ending up in the emergency room. I mean, when you think about dental care, when they're getting the dental care that they need, they're not ending up in the ER for an abscess or for, these things that could be prevented. I've never spoken publicly about any of this before or at all. And I know it can be scary to be the one. I know it can be scary to be the one to put your head out and say something, but all of us are here today because we understand that this is too important for us to keep quiet about. I'm so proud to be part of this fight with all of you to protect our right to care and protect the health and safety of our communities. Thank you.
Wow. All right. We have Elizabeth Hassler from the Redwood Coast Regional Center. And so far, you have heard some wonderful people speak. You're going to hear one or two more, and I really want you to listen carefully. And then we're going to have a song. I'm just warning you.
We're going to have a poem first. So I'm Elizabeth Hassler. I am here today because I'm a regional center client. Like, I'm literally physically here today because I'm a regional center client. And I am so privileged to work as an advocate representing 5,000 people in my rural Northern California area, and 500,000 people who are my peers, who have significant, varied, and lifelong disabilities, and we all are part of the world and part of the crowd here today. So my shirt says, disability is not a dirty word, so I won't say any dirty words today. But I did want to tell you some things about my life. So this is a poem about regional centers. I am just one person. I use 13 hours of help every day to move my limbs, clean up spills, change my clothes, cook food and wash dishes, unbreak my back and my broken down skin, leave my house at all. I am just one person. I drove 6 hours to get here from a town with one wheelchair cab and no weekend buses and many big trees. That is, yes, still California. I am just one person. I need 3 medical appointments every week so I can work part-time. 8 people come through my house and take me everywhere I go, to the store, to my parents' house, to the rally mic. I am just one person. 20 other people use the same service agency I do, which creates 50 jobs. I am just one person. I say, conservatively, 20,000 words a day. I have a friend who clearly says 5 words. Monday, bus, duh, yeah, no. She gets very frustrated, hits, throws things, does 4 loads of laundry every day to stay clean. She is already close to a nursing home. She would not survive. I am just one person. I have a friend who was an open water lifeguard before she had a massive seizure that split her seizures open. Now she has 6, 12 seizures every day, and those are the smaller ones that don't make it harder to walk. She is afraid to leave her bed after noon because her symptoms get so bad at night. I am just one person. I have dozens of friends who could drive me to the poetry workshop in the apocalypse because I have a wheelchair van Medicaid paid for. I have a wheelchair van Medicaid paid for. At least, so I could get a ride, at least for a while, before folks get tired of my needing body and my needing to please them to live when the only help is free. I am just one person. I know dozens of people who only talk to people at their day program Medicaid paid for because friends get tired and strangers call them names. I am just one person. I have a friend who communicates with her eyes and eats through a tube and taught herself to read. I am just one person. I have a friend who wants to learn to use the bus, and he needs a worker who speaks Spanish. I am just one person. I was young once. So many babies are growing into young people and getting what they need. This is Medicaid. I am just one person. I have a friend who is like me, but he still lives at home, and his mom needs a cancer treatment. This is Medicaid. I am just one person. I have dozens and dozens of peers who need 2 staff people all the time just to stay safe, secure, uninjured. Maybe 3 to join community events for more than 1 minute. Don't they belong here with us? Don't they belong in the world? I am just one person. I am here to feed you the world of developmental disability with my mouth and my body the best I can. I am just one person. I am one of 1% of California, of 500,000 of us, of at least 5 of my friends who are here, and more people I don't know, and more people you don't know that use these same services, plus everyone who serves us and loves us. I deserve the chance to serve and love every one of us, and so do you. This is Medicaid. I am just one person. I have the whole world around me. I am just one person. I need the whole world around me. I deserve it.
She is one person. And talking about her friends and family and everything, you see why this is very important. And you see why we're all here. Now, all right. All right. We are now going to hear from Nikki Buckstead, a leader with more than 30 years of experience in social services in the field of mental health, substance abuse, and homelessness. Nikki is the CEO of the Child and Family Center in Santa Clarita.
Thank you so much.
I got that out right.
Yeah, pretty good. Good morning, everyone. Thank you for coming and being out of such an important day. Thank you to all the speakers that went before me. Very heart touched and had to hold back some tears there. So my name is Nikki Buckstead. I get to be the CEO of Child and Family Center located in Santa Clarita, California. It's in Los Angeles County, and it's the third largest city in Los Angeles County. Thank you again, everyone, for coming out to support this critical resolution. So Child and Family Center was created in 1976, and we primarily serve children's and youth and teen, transitional aged youth and foster youth and their families in mental health programs. Mental health is health care. You cannot separate the two. So when we're talking about Medi-Cal and Medicaid, it directly impacts nonprofits that have Medi-Cal services, and specifically I'm going to be talking about the children in California that are going to be so incredibly impacted if this critical funding is taken away. So we provide comprehensive prevention, early intervention, diagnostic evaluation, counseling, therapy, substance use treatment services. We also operate the only domestic violence program and domestic violence shelter in the Santa Clarita Valley. Everyone that walks through our doors is Medi-Cal eligible or on Medi-Cal. We don't serve the population that's lucky enough to have Blue Cross, Blue Shield, Kaiser, not bagging on them, but that's a luxury in the United States and in California. So we really are serving the most vulnerable population, and those are the children. So when we're serving, when we're talking about serving these kids, we're serving well over 1,000 kids per month in foster care, in schools, those that have gotten into trouble and might be on probation. And if we don't have these services, it's going to be devastating. You know, what's going to happen to the kids? What's going to happen to the families? And those 1,000 youth that we serve every month result in about 6,000 one-on-one service sessions, 6,000. So that's things like case management. Somebody talked about case management services, helping people find housing, helping them stay in school, provide therapy, seeing a psychiatrist, medication management. Investing in mental health is not a bipartisan issue, right? This is clearly an issue that impacts and affects all Americans. I'm sure everyone can say that they've known someone in their life that has suffered from some sort of mental health challenge. And if we can work with children early on, all the way up through transitional age, we know that we can do things like prevent high school dropouts. We can prevent them from additional emergency room visits because they don't have anywhere else to go. We know that less likely to end up in jail or prisons. So working with children and making sure that children's mental health services continue through Medi-Cal is critical, not just for right now, but for future generations as we see them. If we have about 60% of our funding is Medi-Cal, and more than that is federally funded. So if those services are cut, we will see a drastic decrease in the ability to serve our community. Unfortunately, we would have to, lay off a lot of people. We talked about layoffs. Medi-Cal isn't just for the recipient. There's also a staff person behind there providing those much needed services. So now we're talking about a workforce, right? So, we're really here today to say it's not just your neighbors. It's not just the kids that you go to school with. It's not just the people that you see at the grocery store. This is all of California and all of our nation. And we really want to make sure that that investment continues so that we can continue to thrive and grow. And thank you so very much.
We've had some amazing speakers, and there are so many more people right behind me who could talk about all these things. Those of you who are on the other side looking at us, you have family too. And one thing that was said in this last speech, though, is people who work in our government and work to help people. And what is happening, as you well know, they are cutting work, getting people and telling them, asking them, what did you do today? Tell me exactly what you did today. And I say, I fucking worked. I did my fucking job. And they are firing them. And they are firing staff that help the people we're talking about. And this is really unbelievable to me. Now, we were talking to this lovely lady who lost her father. On November 6th, my husband said to me, I cannot live 4 more years under Trump. 5 hours later, my husband died. I'm going to keep working against Trump and against the people that are working against these people here, and I'm going to keep doing it as long as I can. So I want to teach you a little song that I sing. And I have the worst voice in the entire world. So you will learn this because you're going to say exactly what I say. And I really don't need this damn thing. Say exactly what I say, and you'll learn it, okay? So, everywhere we go, people want to know, who we are, so we'll tell them, we are the people, people in California, we are the people, working for Medicare, working for Medicaid, working for health care. So everywhere you go, when people want to know, who you are, just tell them, we are the people, we are the people, working for health care, working for Medicaid, working for Medi-Cal, Thank you. You want to do the ends for us?
Okay, I just want to thank everyone for being here. Thank you to everyone who spoke. I don't know where that came from. Okay. Beep, beep. And but thank you to everyone who spoke, such powerful stories that folks shared. But I think that this really shows the breadth of what we're talking about, of how many millions of Californians and millions of Americans will be impacted if these cuts happen, if the cuts to Social Security, Medicare and Medicaid or Medi-Cal go through. We cannot accept that. We will not accept that. We will stand up and fight. We're fighting every single day. We're going to make sure that AJR 3 passes and sends a strong message to Congress and this federal administration that we will not stand by while people have their health care cut, their livelihoods cut, their ability to thrive and survive cut. We will not accept that in California. We will fight and we will win, right? Thank you, everybody.
And we're doing it for your generation, the next generation, and the generations beyond that. This is your job. Thank you.